Thank you for joining us this morning. David Hertel in for Elias. Last week, because he retired, former public health czar in the U.S., Anthony Fauci, remember him from the pandemic, came out with his memoirs. And this has sparked a very interesting conversation in the U.S. about what lessons can we take from the way we handle the pandemic. And even in his memoirs, he says there's certain things that he would have done differently. He expressed some regrets. And so I think it comes upon us to have the same type of conversation. I haven't seen a lot of that in Canada, not around in Montreal or Quebec, and maybe I'm wrong, but definitely wanted to start this conversation with our next guest. Know him well, knew him throughout the pandemic, Dr. Chris Labos, an epidemiologist with a degree in cardiologist. Dr. Labos, thank you for joining me this morning.
Oh, thank you for having me.
So, I'm sure you saw the whole media excitement around Dr. Fauci's release of his memoirs last week. Obviously, I don't want to go through the book and what happened in the U.S. There are a lot of differences with what happened in Canada and right here in Quebec. But in terms of looking back and where we are today, what stands out in terms of now seeing, looking back, and the dust is a bit settled, so to speak, in terms of how we managed it collectively and things that you now know we should have or could have done differently, or maybe I put it differently than looking ahead, because we've all been saying there's going to be a next one. What should we do, or what are we doing to prepare the right way? There's a lot of questions there. Where do you want to start?
Well, here's the thing. If there's one big knowledge thing that we gained during the pandemic, it was about the airborne spread of viruses. Because prior to the pandemic, if you had asked anyone about airborne spread, they would have said, yes, it's true for tuberculosis, it's true for measles, but most other diseases do not spread by airborne transmission. And there's an interesting historical reason why that was the case. People used to believe that malaria was spread by bad air. That's in fact what the word malaria means, malaria, so it's from Italian. And so the germ theory of disease, that there were actually bacteria and viruses that were being spread from person to person, was really what changed that thinking about there being bad air, about there being a miasma that would go and infect people. And so because now we had a germ theory, because we knew that diseases had to be spread person to person, the idea that you could have virus particles in the air, bad air, became almost seen as something that was outre or anachronistic. And so there was a lot of resistance against it, except for very specific things like malaria, like measles, tuberculosis, that were very infectious. So even for influenza, we would say things, it's really droplet precaution. So that's where this whole idea of, masks don't really do anything. They're more to protect, they're more to prevent the spread than to protect the person, the whole 6 feet distance thing. A lot of that was based out of our assumption that COVID was going to behave the same way influenza did. And I think as a result of the pandemic, we've learned that no, there is actually a lot of heterogeneity in how infectious different things are. COVID turned out to be much more infectious than anybody initially assumed. And we've also learned that airborne transmission is a really important thing, especially indoors. And it took a while for us to appreciate that. So a lot of the subtleties that Fauci was talking about, how wearing masks outdoors, probably not all that necessary because you're outdoors. Well, that was something nobody really knew at the beginning. And so I think a lot of people are very locked in to the conversation from early 2020. And they're like, yeah, but in 2020 you said this. I'm like, yes, that's true. But in 2021 and 2022, the messaging changed. But I think for a lot of people, the conversation around COVID never changed beyond 2020. And so we've learned a lot more. The question is going to become, are we going to be better prepared next time? I don't know that we are, because when we start talking about upgrading our schools and our office buildings to improve indoor air quality, to get air conditioning in our schools, we're not really addressing that issue as aggressively as we might. And at the end, it's not that, obviously it's difficult, but there's nothing inherently technically complicated about upgrading the ventilation system, about buildings. Obviously, it takes a long time. Obviously, it takes money. But we have the know-how. We just have to have the political will to actually make it happen.
I want your take on curfews, because this was huge in Quebec. We didn't see that many curfews elsewhere in North America. We did see some, but in Quebec it was huge. What do we now know about the effectiveness of curfews?
I don't think we really know, because so much was happening simultaneously. It's always impossible to tease out, did this one measure make a difference? And this was the conversation at the time. It's like, well, what's the evidence? There wasn't, right? And a lot of times governments had to make the best decision they could with the information at their disposal. The rationale for the curfew, for people who remember, was to avoid people from having dinner parties at their house, because this was happening. I mean, I had physician friends during the worst of COVID. I would call them like in the middle, at night because of a patient, and they'd be like, "Oh, sorry, I have people over." I'm like, "You have people over? What are you doing?" And so that was the government's response. Was it appropriate? Was it necessary? It's a very hard thing to say. I mean, again, and it really depends on where you lie on the spectrum of individual liberty versus collective responsibility. Did it make a difference? I mean, it probably made a little bit of a difference in terms of discouraging people from gathering together to spread the virus. There are people who are going to say, like, well, it's up to you to take personal responsibility, and if you get sick, you get sick. I mean, that's not a position I myself would positionally espouse, but it's going to be interesting. I think it's going to be more difficult to do something like this in the future, because we don't have concrete data that it made much of a difference, because so much was happening simultaneously.
There would be a lot of other topics to touch on, and I hope we continue this conversation, Dr. Labos. But my last one would be, obviously, the big one to me is, of course, vaccinations. Yeah. And so how do you see the whole controversy around vaccination and the anti-vax movement, and now that we have more data on the effectiveness of these vaccines, where do we stand on the whole issue of vaccination?
Well, I mean, the anti-vaccine movement predated COVID. Yes. It is obviously going to survive COVID. I mean, the people who are opposed to vaccines, there's always going to be a small core of people that are going to be opposed to vaccines no matter what. I think the vast majority of people are either pro-vaccine or have questions and are looking for good information, and that's why I do what I do. I think going forward, we're going to end up treating the COVID vaccinations in the same way we treat the influenza vaccination. It's probably going to be a yearly vaccine that's updated every year to try to better match the circulating strains. And I'm going to get the COVID vaccine every year because, I really don't need to develop long COVID or have any long-term complications. And the vaccines are the one thing that actually does seem to make a difference with regard to long COVID. So I think that's how we're going to do it. And I think it's going to be a challenge every year because our uptake of the flu vaccine is not great. And so I suspect our uptake of the COVID vaccine is not going to be great either. And a lot of people say, well, I'll just accept the consequences. And that's all well and good until I don't think people fully appreciate what the healthcare system looks like right now. So I think people who think that, it's going to be easy if I get sick, it's going to be kind of hard for you to access a doctor. Even getting some therapies for COVID now, like Paxlovid, or even getting steroids, actually surprisingly difficult for a lot of people. So I would be, now in the summer, there's very little COVID, relatively speaking, even though I still see people getting sick. I think we have to realize come the winter, you might want to be a little bit more careful because there will be COVID, influenza, RSV, and a whole slew of things circulating.
I remember during the pandemic when I was filling in for Elias and for Aaron, you were one of our go-to doctors. You did a fantastic job, and it's great to be able to count on you again to see what lessons are to be learned and how to prepare for the next one. Dr. Labos, as always, appreciate your time and insights.
Thank you very much.
Dr. Chris Labos, epidemiologist with a degree in cardiology.